I'm never gonna dance again. These guilty feet have got no rhythm. Though it's easy to pretend, I know you're not a fool. Should've known better. Kylie, stop. Kylie. We're gonna be sued. That's copyrighted. We can't just sing George Michael in the middle of Vula, please. Can we just get to the video, please? I mean, I know you're trying to sing about whisper symptoms, careless whisper. I get it, very good. But just let's go to the video. Thanks. Cool. Okay, so I know that it said that this is Shana, but I think her name should be Mavis, because Mavis is a kind of a far more postmenopausal name, I guess. Remember that this can apply to younger women with BRCA, for example, who've got ovarian cancer, but the majority of ovarian malignancies are going to be postmenopausal women. The commonest type is your epithelial layer of origin kind of carcinoma. And the reason that Kylie Koala was singing about the whisper symptoms is that unlike something like endometrial carcinoma, where there's bleeding and it's blood and it's very dramatic, ovarian carcinoma takes a long time to start manifesting symptoms because the ovaries are very, very deep down and far behind retroperitoneal, as per the anatomy video. So a mass has got to be pretty big by the time it starts causing symptoms. And so one of the biggest problems that we have with ovarian CA is that women come in the very late stages because nothing is detected beforehand, or nothing obvious that can be linked to an ovarian carcinoma. And those initial symptoms that you need to keep your eyes and ears open for are those whisper symptoms. Okay, so now what are those? All right, so a patient might start just feeling like meh, just like not great, something's not feeling myself, I'm tired, might have a bit of sort of pelvic heaviness or discomfort. It's not going to be the same kind of acute pain of a torsion, for example, but it's going to be a heaviness, a discomfort. There might be pressure symptoms, so bladder and bowel symptoms, anything that a large mass in a pelvis can cause. And as that mass grows and grows, it might still be within the pelvic brim. So the patient might still not be aware that that's happening, but because that mass is pushing the abdominal contents up, she might start having a bit of dyspepsia, okay? Discomfort in the hypochondrium. Let's move our mass a little bit that way so you can see that, okay? She might start having early satiety, nice big full plate of food there, and now she can only manage that much because this big mass is starting to compress the stomach upwards and make the stomach area smaller and the contents smaller, and also push that food back into the esophagus, hence the dyspepsia. So a lot of the discomfort is caused by the slowly growing mass that's coming out of the pelvis. And then eventually a patient will notice that there is a mass arising out of the pelvis. It will be quite palpable to the patient. And then by the time they come to examination, so I'm going to take off this outfit and I'm going to put on this one because she's lost a lot of weight. Okay, often patients with ovarian CA are quite cachectic because it's been growing for a long time and everybody's been ignoring her dyspepsia and pelvic discomfort, and she's just an old lady, we're just not going to pay attention to her. So when you examine your patient, they're going to be wasted, most likely, because they usually present late. They're going to have, which is her left supraclavicular node, that's the VT node. She may have an umbilical node. In fact, I'm going to put that umbilical node on top of the mass. Okay. She's going to appear to have a distended abdomen, obviously. And when you examine her abdomen, you're going to feel this mass arising out of the pelvis, a solid tumor. And you're also going to feel ascites if she's had local spread across inside the pelvis. You will feel ascites. And then, of course, if we're really far down the line and she's got Mets, which she may very well have because they present late, she may have something cooking in the liver. So she might have, oh, the liver's a little bit higher than that. She might have jaundice, she might have hepatomegaly or tender liver. It can metastasize to the lungs, so she might have a new onset chronic cough. And it can also metastasize to the brain, in which case you might have focal neurology, or more commonly you're probably going to have the onset of seizures. Okay, so that is the most important thing for you to understand about ovarian carcinoma, okay, is that it doesn't initially manifest with symptoms that are obviously gynecological. It often manifests with digestive tract stuff and constitutional symptoms, and then nobody can find anything because nobody examines the pelvis or nobody thinks about the ovaries. Meanwhile, that is the source all along. When you do your gynecological examination, it's your vulva and vagina on inspection are going to be normal. Your cervix is going to be normal. It might be pushed posteriorly because if this is the ovarian mass, it often grows over, let me do it laterally. It can grow over the pubic brim. So if this is anterior, it can go over, and then the whole uterus can be pulled, and so the cervix can be more posterior. And then obviously on the bimanual, you're going to feel this great big mass arising out of the pelvis. And then you are immediately going to be thinking of an ovarian tumor in a postmenopausal woman, because fibroids do not happen in postmenopausal women, okay? And the fibroids are the commonest ones other than pregnancy in women of reproductive age. But in postmenopausal women, your first thought has got to be ovarian, and she definitely needs more investigations. I'm not going to talk to you about investigations because I don't think you need to know about the investigations, because unless you become a gynae oncologist, you're not going to do them. I want you to know how, in the first instance, to suspect an ovarian carcinoma and know that your management is to refer. The end. Thanks, Kylie, for your performance here. Sing away. I'm going to switch the video off and we won't get sued.